Hey, future counselor. If you want to finally feel confident about the core concepts behind addiction and you want to walk into your exam knowing exactly how to think like an addiction professional, this video is going to help you. So many people study everything except the basics, but the truth is, if you don't fully understand the basics of addiction, every other exam topic becomes harder. Understanding the foundation helps you answer your questions accurately. In this video, I'm going to break down addiction in plain and simple language. By the end, you'll be able to define addiction, understand major addiction models, and you'll see why this field is a specialization. And if you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I work with future counselors to help them study smarter, build confidence, and pass their addiction and mental health exams. If you want to pass your exam and start thinking like an addiction professional, you're in the right place. Before we start, here's what you'll learn in this video. You're going to learn what addiction actually means and how it's different from terms like substance use, misuse, and substance use disorder. These terms come up a lot on exams, so it's important to know the differences. We'll talk about the main ways people explain addiction, like the disease model, the brain model, and the biopsychosocial approach. These help you understand why addiction develops and what keeps it going. You'll also learn why addiction is its own specialty and not just regular mental health counseling. There are unique skills and knowledge that addiction counselors need. I'll walk you through common job titles, and we'll also cover the main certifications and licenses future counselors may need depending on their state and career goals. And finally, you'll hear why addiction professionals are so important in prevention, treatment, and helping people stay in recovery long term. Let's go ahead and get started. When we talk about addiction, we're talking about more than just drug or alcohol use. Addiction is a chronic condition that affects both the brain and behavior. It usually starts with a strong urge or cravings, something that feels rewarding at first, but over time becomes harder to control. A key sign of addiction is loss of control, even when the person really wants to cut back or stop. Addiction can involve substances or behaviors that includes gambling, gaming, or spending. Anything a person can do even when it's causing harm to their daily life. The most important part of the definition is this: addiction continues even when it's causing harm. That might be harm to their health, relationships, responsibilities, or overall functioning. So in simple language, addiction is when a substance or behavior becomes something a person can't easily stop, even when they want to, even when it starts to negatively affect their life. When people talk about addiction, they often use a lot of different words, and sometimes they mix them up. As future counselors, it's important for you to understand what each term actually means, especially for your exam. Substance use is the most neutral term. It simply means a person is using a substance. It doesn't tell us if it's healthy, risky, or harmful. Substance misuse means the person is using the substance in a way that could cause harm, like taking more medication than prescribed or using substances in unsafe situations. Misuse doesn't automatically mean addiction, but it is a red flag. Substance abuse is an older term that many people still say. Actually, it's still in one of my certification titles, but it's not preferred. We simply use substance use now because it's less stigmatizing. Addiction is the everyday word people use to describe compulsive behaviors and losing control. It's common language, but not a clinical diagnosis. And finally, substance use disorder, or SUD, is the correct current diagnostic term we use in counseling. SUD can be mild, moderate, or severe and is based on specific criteria. So even though people sometimes use these words as if they mean the same thing, they're actually very different. And as an addiction professional, you are expected to know the difference and be able to explain the difference to others as well. When we talk about addiction, we're not just talking about substances, we're talking about how people learn, cope, survive, and respond to life. Models and frameworks help us make sense of all of that. A model is basically a theory, is a way of explaining why addiction happens. Is it the brain? Is it trauma? Is it habits? Is it biology? Models help us answer those questions. A framework is like an organized lens we use to understand how addiction develops and how it affects someone's life. It's the structure we use to guide our thinking, our assessments, and our interventions. So when we put them together, addiction models and frameworks give us different perspectives. Some focus on brain and neurobiology, some focus on learning and behavior, and others focus on the person's environment, trauma, or community. And some puts it all together, like the biopsychosocial model, which looks at the full picture. These beliefs really matter because the way we understand addiction shapes everything else we do. How we assess, how we talk to clients, what interventions we choose, and how we support long-term recovery. They also help us stay non-judgmental and look at the people with compassion and not blame. On your exam and in real life, those models help you think like a counselor instead of just memorizing information. Let's walk through the main types of addiction models you'll hear in the counseling field. Each model gives us a different way to understand why addiction happens and what keeps it going. No single model explains everything, but together they help us see the full picture. First, we have the disease model. This model views addiction as a chronic medical condition like diabetes or hypertension. It focuses on the idea that addiction changes the brain, and because of those changes, stopping isn't just about willpower. This model supports treatment approaches like medication-assisted treatment and long-term recovery supports. Next is the brain or neurobiology model. This model zooms in on how addiction affects the reward system, motivation, memory, and decision making. It explains cravings, withdrawal, tolerance, and why people keep using even when they don't want to. This model is very common in modern research, and you'll see this on your exam. Then we have the learning and behavioral models. These models focus on habits, coping behaviors, reinforcement, and triggers. Basically, this model believes addiction develops because the behavior is rewarding, repeated, and eventually becomes automatic. This model connects closely with CBT, skills training, and relapse prevention. There's also a biopsychosocial model. This model believes addiction isn't created by just one thing. It's a combination of biology, psychology, trauma, stress, mental health, family systems, and environment. This is the model we use for person-centered treatment planning and holistic care. And finally, we have the sociocultural models. These look at how community culture, access to resources, social norms, racism, poverty, and stress influence addiction. This model reminds us that people don't develop addiction in isolation. Their environment matters. As future counselors, you won't commit to just one model. You'll understand all of them and use whichever perspective makes sense for the client in front of you. And on your exam, these models help you pick the answer that shows empathy, clinical understanding, and real-world perspectives. So why do these models and foundations even matter? Because the way we understand addiction shapes everything we do as counselors. When you understand the different addiction models, you stop looking at addiction as a bad choice or a lack of willpower, and you start seeing it through a clinical, compassionate lens. These models help you understand what's really going on underneath someone's behavior. Their brain changes, their coping patterns, their trauma history, their stress, and their environment. These foundations also guide your assessment. If you're using the biopsychosocial model, you'll naturally ask better questions. If you understand the learning model, you'll recognize triggers and reinforcement cycles. If you understand the disease model, you'll appreciate why medication-assisted treatment or long-term care may be needed. They also guide treatment planning. The model you lean on affects the goals you write, the interventions you choose, and how you support someone through change. And on your exam, these models matter because they help you choose the answer that reflects real clinical reasoning, not assumptions, not judgment, not stereotypes. More importantly, these foundations help you show up with empathy. They help you shift from what's wrong with this person to what happened to this person, and how can I support them? As future addiction counselors, models and frameworks give you the language, the understanding, and the structure you need to help people heal and to pass your exam with confidence. When we say addiction counseling is a specialization, we mean that it requires knowledge and skills that go beyond general mental health work. Addiction isn't just about substances, it affects the brain, the body, behavior, relationships, decision making, and the person's entire environment. Because of that, it takes specialized training to fully understand what's happening and how to help. Addiction involves cravings, tolerance, withdrawal, relapse patterns, safety risks, and co-occurring mental health challenges. You can't just guess your way through this work. You need a strong foundation in assessment, ethics, relapse prevention, motivational interviewing, and how addiction affects the brain. That's why we have credentials and national exams that focus on specific substance use treatment. Here's another important part. Addiction is not only a specialty for counselors, other professions also specialize in addiction. Doctors can become addiction medicine specialists. Psychologists may focus on addiction research, trauma, testing, and advanced therapy models. Nurses can earn certifications in addiction nursing and work in detox, MAT programs, and recovery settings. Social workers can also specialize in case management, family support, housing, and community services for people in recovery. Counselors like us specialize in assessment, relapse prevention, individual and group counseling, and long-term treatment planning. Addiction requires a team, medical, behavioral, psychological, and community-based. Every professional brings a different lens, but we all share the same goal of helping people heal, rebuild their lives, and stay safe. So when we call addiction counseling a specialty, it's because the work is complex, the population is vulnerable, and the knowledge we need to help someone recover takes training, practice, and a strong understanding of the science behind addiction. When you step into the addiction field, you'll notice there are a lot of different job titles. Some roles are clinical, some are medical, some are peer-based, and each one plays an important role in supporting people through recovery. You may hear substance abuse counselor, addiction counselor, or SUD counselor. These are the frontline professionals who provide individual counseling, group therapy, relapse prevention, and treatment planning. Then you have credentialed roles like licensed and certified staff. These are certification licensure levels that show someone has completed specialized training in addiction and passed state or national exams. On the medical side, there are addiction medicine physicians and addiction psychiatrists who manage detox, prescribe medication like Suboxone, and oversee medical aspects of treatment. Psychologists may specialize in trauma, assessments, or advanced therapy approaches. We also have addiction nurses, detox nurses, and residential treatment counselors who support clients in structured programs. And then there are recovery coaches and peer support specialists who use their lived experience to guide and encourage individuals in recovery. These roles are incredibly important because they offer a level of connection and understanding that clients deeply value. Finally, case managers and group facilitators support clients with resources, coordination, and skill building in settings like IOP and residential programs. All of these roles work together. Addiction treatment is a team effort, and every professional brings a different perspective that helps clients move towards recovery. In the addiction profession, you'll notice there are different levels of credentials depending on your education, training, and your state requirements. These credentials show that you have specialized knowledge in substance use counseling and that you've met certain professional standards. One you'll see is CADC, Certified Alcohol and Drug Counselor. This is a widely recognized credential that focuses on addiction counseling skills, ethics, assessment, and treatment. Then there's the CSAC, Certified Substance Abuse Counselor, which is usually state-specific. Requirements vary, but it generally includes coursework, supervision hours, and a state exam. The next level is the Licensed Substance Abuse Treatment Professional. This is an advanced license for professionals who want to work more independently, supervise others, or take on higher level clinical responsibilities. It requires a master's degree and significant training in addiction. You also have your broader mental health licenses like LPC, LMHC, or LCSW, and many professionals in those fields choose to specialize in substance use by completing additional coursework, supervision, or certifications. Each of these credentials help you develop deeper skills in assessment, treatment planning, relapse prevention, documentation, ethical decision making, which are all crucial in addiction treatment. No matter which path you choose, these credentials help clients, employers, and the community know you're trained, competent, and committed to providing the safe, evidence-based care. In the addiction profession, there are a few major national exams you'll hear about, and understanding the differences will help you plan your career path. The first set is the NADAC exams, which include the NCAC 1, NCAC 2, and the MAC exam. These are widely recognized across the U.S. and are designed to measure your knowledge of addiction counseling, ethics, assessment, treatment planning, and professional responsibility. The NCAC 1 is more entry level and focuses on foundational skills. The NCAC 2 builds on that with more clinical depth and is often used for higher level positions. And the MAC exam, Master Addiction Counselor, is for professionals who already have strong experience and want to demonstrate advanced competency. These exams are rigorous but fair, and they're aligned with the real skills you need to support clients safely and ethically. Then you have state-specific sub-exams. Some states create their own testing requirements for certifications like CSAC, CADC, or LADC. These exams focus on laws, ethics, and practice standards specific to that state. So if you're becoming a certified counselor in a particular state, you'll need to follow that state's pathway. The goal of all these exams is the same: to make sure that anyone working in addiction counseling understands the foundations, screening, relapse prevention, treatment planning, and crisis decision making. These exams help ensure your future clients can trust you, and they show employers that you've met national or state level standards. In this profession, when we talk about international certifications, we are probably talking about the IC and RC, the International Certification and Reciprocity Consortium. This organization sets global standards for addiction counseling, and their exams are recognized in many U.S. states and in over 25 countries. One of the most common credentials is the IC and RC ADC exam, which stands for Alcohol and Drug Counselor. This exam measures your competency in screening, assessment, treatment planning, counseling skills, documentation, and professional responsibility. Many states use this exam instead of creating their own, so passing it often allows you to transfer your credential if you move. The next level is the AADC, or Advanced Alcohol and Drug Counselor. This is for counselors who have a higher degree and more clinical experience and want to work at an advanced practice level. There's also the CCJP, the Criminal Justice Addictions Professional Credential. This one is specifically for people working in probation, corrections, drug courts, diversion programs, and other justice-involved settings. It focuses on understanding addiction within the criminal justice system. So if you plan to move states or work across multiple systems, an IC and RC credential can get you more flexibility. These international certifications show employers that you've met high standards, and they can open the door to more job opportunities, higher pay, and specialized roles within the addiction field. Peer support recovery specialists play a vital role in the addiction profession. These are people who use their lived experience in addiction and recovery to support others, and they are truly one of the most powerful parts of the treatment system. One of the main roles you'll see is the peer recovery specialist, or CPRS. These individuals have been through recovery themselves, and they've trained to support clients with encouragement, accountability, and hope. Peers help clients feel understood in a way that professionals sometimes can't. You'll also see recovery coaches who focus on helping clients build daily structure, make healthier choices, and reconnect with the community. They're often the bridge between clinical services and everyday life. These roles don't replace counselors, they work alongside us. Peers help reduce stigma, model what recovery can look like, and offer support from a place of real experience. Counselors bring clinical skills. Together we create a team that supports the whole person. Peer roles are essential because recovery just doesn't happen in sessions, it happens in the real world. And having someone who has walked the same path beside you can make all the difference. As addiction professionals, We play a vital role in keeping individuals, families, and communities safe. Our work matters because addiction isn't just about substances, it's about the brain, behavior, trauma, environment, the entire person. Addiction professionals help clients understand what's happening in their brains and bodies in a way that reduces shame and increases motivation. We teach people real skills that help them stay safe and move forward. A huge part of our job is promoting safety. We're trained to recognize withdrawal symptoms, overdose signs, crisis situations, and when someone needs medical help or a higher level of care. We also support long-term changes, not just short-term goals. Recovery is not a straight line. There are setbacks, relapses, moments of doubt, and addiction professionals help clients navigate those moments to rebuild stability and to keep going. We don't do this work alone. Addiction professionals collaborate with doctors, therapists, nurses, probation officers, case managers, peer recovery specialists, and the community. It's truly a team effort. And just as important, we help reduce stigma. We challenge myths and stereotypes and help people understand that addiction is a health condition, not a moral failure. Finally, we're responsible for accurate assessment and documentation, which supports ethical and safe treatment decisions. In short, addiction professionals change lives. We help people feel seen, supported, and help them understand they are capable of recovery. And that impact lasts beyond counseling. If you are an aspiring addiction counselor and you're watching this video, it means you care about becoming a confident, ethical, and knowledgeable professional. And you want to pass your addiction exam so you can move forward in your career. And I want you to know you're in the right place. This field needs people like you, people who show up with compassion, curiosity, and a real desire to help others rebuild their lives. Addiction work is not easy, but it's some of the most meaningful work you will ever do. On this channel, I break down the information you actually need in a way that's simple, clear, and evidence-based. I help you understand the hard concepts, not just memorize them. Because when you understand these foundations, you can answer exam questions with confidence. You've chosen a powerful specialty, and I'm honored to walk with you on your study journey. Now that you know the basics of the addiction counseling profession, you've finished the entire video, go ahead and subscribe so you don't ever miss a weekly addiction exam study video. I'm here to help you share what I've learned and continue to learn myself with you. Let's stay connected so I can help you build confidence, help you study smarter, and support you in passing your exam. I'll see you at the next study session.